Good morning. My name is Larry Chinitz. I am the Director of Cardiac Electrophysiology at NYU Langone Health in New York City. Well, I think many of us know that there has been a true revolution in the field of cardiac pacing that involves the desire to do conduction system pacing, which means to pace the heart, affecting the normal conduction system to simulate normal conduction as much as possible. Standard pacing creates some dyssynchrony in right and left ventricular contraction, which has been shown to have some physiologic significance. So we have all accepted conduction system pacing to a certain extent, but until recently, it was sort of limited as to the tools that were available to accomplish this feat. So the importance of the BioConduct trial is that it was a prospective multi-center study that utilized the standard stylet-driven leads with retractable helixes to engage in conduction system pacing, as opposed to the lumenless leads that have been used exclusively up until recently. So the inclusion criteria were pretty much for anyone who had standard indications to need a pacemaker, which means heart block, sinus node dysfunction. Most of the patients had either heart block or sinus node dysfunction. A small group of the patients had primary heart failure or atrial fibrillation or were planned to have AV node ablation, but predominantly it was standard indications for pacing. So most importantly, the success of achieving conduction system pacing in our study was over 95%. And that was very much in line with the success that has been reported for the standard approach with lumenless leads. So we were very pleased about that. And this was a 3-month evaluation. At the end of this evaluation of 3 months, the electrical parameters of R-wave sensing and left ventricular thresholds were excellent and as good, certainly as good, non-inferior to that which had been achieved with the standard approach. So most importantly, the study showed that you could, in fact, achieve good conduction system pacing very much in line with previous tools, but now you had the advantage of using standard leads and other technologies to do that, each of which can have some advantage. There are some specific advantages of using a stylet-driven lead, most importantly of which is you can actually pace the heart as you screw in the lead, which gives you lots of information in terms of when to stop screwing, when you've achieved conduction system pacing. It's pretty much an important advantage, and you can't do that with standard lumenless leads. It also has the advantage that the leads are a little larger, so there's more body to them, which makes it a bit easier to manipulate them in the heart. So it was a really important study to show that we're not limited on what we can use to get conduction system pacing. The other part of the study that was important was that we used pre-specified parameters that correlate with the success of conduction system pacing, and the operators had to achieve those parameters. The importance of that is that we did show that we had true left bundle branch area pacing in all of our patients, 98% of our patients, which was a very positive result. Well, it most importantly greatly expands the tools that we have available to us to pursue conduction system pacing. Hopefully, it will allow more operators to engage in this procedure, which is most likely quite superior to standard pacing. It also allows us to combine different technologies from different companies with conduction system pacing that should be to our advantage and, most importantly, to the patient's advantage. Well, I think the most important take-home message is that conduction system pacing is here to stay, and we want to create a scenario where increasing number of operators feel comfortable with it. We want to improve our long-term results, and we want to make sure that all patients will have access to this technology when appropriate. And the use of retractable stylet-driven leads clearly increases the potential that we could achieve those results.